Okay, well, my name is Terence Canning. I'm involved with the UK Sepsis Trust. I'm the executive for Wales. I became involved with them after my brother died of sepsis. That was 3 years ago now. Mark was aged 41 years old, married with a 3-year-old daughter at the time, and he was taken ill with a common infection, really, stomach infection, which gave him what he thought was gastric flu. He was diagnosed initially as gastric flu, but unfortunately it was a lot worse than that, and he didn't realise at the time. And he walked into hospital in London on the Thursday lunchtime. He was in full cardiac arrest by 5 p.m. that day, and he unfortunately was pronounced dead after 3 days in intensive care on the Saturday. We'd never heard of sepsis. He certainly had never heard of sepsis, and that was mine and my family and friends' introduction to it. So obviously, having coped with the shock of my brother's passing, and then discovering there was an illness out there which had killed him that I'd never heard of, I was very keen to get involved and find out more about it. And the more I knew about it, the more shocking it was, because we thought my brother was really unlucky. And as it turns out, he was one of at least 37,000 died that year, and 37,000 or more would have died every year since of something which I also later found out is kind of a pretty straightforward treatable disease. If caught timely, if there's the right intervention, simple antibiotics can definitely save people's lives, can certainly improve their outcomes. So basically what it came down to for my brother, that he died of a treatable disease that we'd never heard of. So the aim was to get involved, to raise awareness. That comes from education. It's what we do now, it's what I do now, is to educate people, public and professionals, to think about sepsis, to recognise sepsis, because that's the key. Education, awareness is the key to solving sepsis as a major health issue. It shouldn't be a major health issue because the solutions are really already out there. But unfortunately at the moment it is. And the aim, the goal, and continues to be the goal until we get there, is to educate, to raise awareness, because there's no doubt about it, the timely intervention, early recognition will definitely save lives.